I mentioned I use 3 different techniques to find my flow chart. These techniques dovetail together to help me understand what we're looking for as far as the patient's needs in that particular case. First, we do the analysis of the body reflex points on the front of the body that you've demonstrated before. We also then test the patients with the homeopathic detoxifying remedies that we've also talked about to get specific categories of irritants. Our third approach is something called body talk. Body talk technique has to do with asking questions of the body and using muscle response testing to get our answer. Remember, we get a yes answer or a no answer, not an essay question answer. We ask the body about reaction to organs, to glandular systems, to various body parts structurally, to environmental factors that might be bothering the body chemistry that might have to do with problems with microbes, toxins, allergies, other types of irritants or intolerances you run into. We go into our active memory synthesis, which deals with the emotional, psychological, the severe stress reaction patient, the patient who might be suffering from post-traumatic stress disorder. And we learn how to do techniques to rebuild the strength of the lymph system, the circulation system, and make sure that the muscular system is completely balanced. So again, the triad of these 3 techniques help me find my flow chart to identify our list of irritants, because phase 1, we always want to identify and correct and remove irritants. And then later on, phase 2, we're going to try to build that patient's body back up once you've gotten rid of the things the body has not been able to correct itself. Once we've done our chiropractic kinesiology examination of muscles and joints, making sure that all muscles are turned on and the brain is talking to body parts, making sure that all joints move, yet don't move so far to move out of place, and of course are not locked or stuck. We then have the patient structurally balanced with muscles and joints, and again, brain talking to body parts. At this time, we examine reflex points all over the front of the patient's body. Each one of these reflex points relate to a different organ system, a different internal functional area. We're asking the question, is there anything inside the patient's body that's out of balance that might need some help or support? We're still looking for all those different irritants we have that cause people ill health. So I'm going to ask you to hold your arm up here nice and strong and do not let me pull here. As I tug each time, you'll just resist me nice and strong like that. I'll touch points up here for brain centers. Hold, 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 hold. We'll check points for sinuses, for throat, for thyroid problems, bronchial, lung, problems with emotions, problems with the heart, liver, gallbladder, stomach, pancreas, spleen, problems for kidney or immune problems, or problems with general virus. Problems for kidney, immune problems, problems with general virus. We're finding weakness on virus points. We think this might be an irritant this patient is not overcome, some form of a chronic virus. We're going to go to small intestine point and large intestine points. Ureters drain the kidneys down to the bladder. We have bladder point, ovary point, uterine point, other points for digestion and internal intestinal functions. Okay. So if we want to ask the body what's out of balance besides her chiropractic spinal problems, we're going to think that this patient has some kind of a viral weakness or a viral irritant they've not been able to overcome. In our diagnostic workup of the ill patient, we use 3 different approaches to find what I think of as a flow chart to teach me where to go, what to look for in this particular patient's needs. We start with our body reflex point testing that we demonstrated earlier, checking the reflex points on the front of the body for any particular organs or systems of the inside of the body that is under stress and needs help. We then test the body with a series of homeopathic detoxifying remedies. Now the word homeopathic I'd like to explain briefly. Homeopathic is a very unusual type of medicine, and it has 2 very unusual characteristics. Number 1, homeopathic remedies are extremely precise. If we give you the correct remedy for your condition, it will help you. If we give you the incorrect remedy for your condition, it goes to your body like distilled water, does not phase a thing. So when we test people with these homeopathic detoxifiers, they are designed specifically to detoxify the body of specific type of irritants. We have homeopathic detoxifiers specific for virus, for bacteria, for fungus and yeast problems, for allergy problems, for parasite problems, for reaction to chemicals, reaction to metals, environmental pollutants, air pollutants, some food additives, acute stress reactions, chronic stress reactions, and a number of other things. So when we test our patient with these vials and a remedy that's going to detoxify them of a certain irritant shows a very strong response in our muscle response testing, we know we have a category of irritant that we're going to add to our list and we're going to be working with to help correct their problems. One of the most important parts of our chiropractic spinal balancing work, according to myself and other applied kinesiologists who've studied the kinesiology to a high level, is something we call balancing of the skull or the cranium. Some of you may have heard of the term craniosacral therapy or craniosacral balancing. This goes with the concept that as we breathe and move, not only does our diaphragm go up and down, letting air come in and out of our lungs, but our entire body breathes and moves in what I'm going to call a synchronous harmonious motion. As we breathe, our tailbone goes in and out and wags back and forth a little bit, almost like a dog's tail wagging in reference to our breathing pattern. At the same time, the joints of the skull actually go through microscopic motion or movement. As you breathe, the skull breathes and moves and shifts very gently, very lightly with every breath. As the skull bones move in synchronous harmony and the tailbone moves in synchronous harmony with our breathing, this helps pump cerebral spinal fluid up and down the entire spinal cord and help keep us balanced. Any patient who has a proper balance of the cranial respiratory motion and motion of the skull plates and skull bones as they breathe, and the sacral respiratory motion of the tailbone, the hips and pelvis as they move and they breathe, need to see chiropractors less often. When the body is properly balanced in the craniosacral system, the rest of the spinal areas want to stay lined up and want to stay adjusted properly. So I'm convinced the most powerful treatment any chiropractor can ever do is a proper cranial adjustment. Those of our patients who've had head impact injuries, auto accidents, work injuries, sports injuries, concussions, closed head injuries of this nature, almost always have cranial distortion problems. One of the other categories I find is that even when the dentist does a meticulous job of restoring our teeth and doing proper dental work and giving us a good bite and a good look, he sometimes inadvertently causes torque of the jaw, the neck, the skull while doing these major dental procedures. Any procedure that's more than a cleaning or a simple filling may cause an inadvertent cranial torque. A number of our patients will not schedule a dental visit for a major procedure unless they schedule a visit with us afterwards, because we often have to help put them back to balance just because of the tremendous amount of pressure and time is involved of torquing the jaw, torquing the skull inadvertently from these procedures. When we're examining the patient for craniosacral balance, we want to make sure that not only are the skull plates lined up and moving properly as the patient moves and breathes, we want to make sure the pelvic joints are lined up and moving properly as the patient moves and breathes. We often will test the patient in different twisted positions. Bring your knees up and bend your knees left. And we're going to try strength here and hold. As she bends her knees left, the pelvis moves nicely, everything is strong. Bend the knees right and hold. As she bends her knees right, the pelvis is balanced and everything is strong. Turn your head all the way left and hold. As we have head rotation in, we remain strong. Turn the head right and let's go with knees to the left. And again, hold. And as we add head rotation, then she's strong. So we look at the balance of the top and bottom system, what I think of as the twin sister locations between the top and the bottom. Everything moves well, everything stays relatively strong. So now, we want to look right up into the skull itself, the so-called cranial area. I'm going to ask you to take a deep breath in, and hold, and blow it all out, and hold. Now, I always tell patients breathing should make us stronger, not weaker. If we get a weakening response on deep breathing in, deep breathing out, these skull plates are not moving and breathing as she moves and breathes. We may need to do a major cranial adjustment to untorque the skull and get all the membranes inside the skull balancing with the harmonious motion of the skull, the spine, and the pelvis. Now, you can get a close-up of this in a moment if you like. Now, at this point, we have a patient with a cranial imbalance problem, and we're going to show a little bit of what it's like to do a major cranial adjustment. I'll be applying some pressure on the back of her head gently with my fingers, and I'll also be taking a finger and pushing up inside the mouth. We have locations inside the mouth that allow us to access most of the skull bones and skull plates and get them back to motion again. Open up for me, please. And I want you to take a deep breath in and out, and in and out, and in and out, and in and out. Now, if we properly brought all the skull plates and bones into balance that breathe and move as she breathes, we should have strength upon further testing. Take that deep breath in and hold, blow it all out, and hold. So there's two rules in craniosacral balancing. We should all be able to twist both left and right without going weak. We should all be able to breathe in and out without going weak. I'm convinced it's not too much to ask for. If we can twist and move and breathe and stay strong, we are much better balanced.